How long can you live with diabetes? Early signs, and is it dangerous? Dear friends, the two words diabetes are enough to worry millions. Countless families watch loved ones struggle with dietary restrictions, injections, and medications. Living with this condition, patients often ask in despair, can diabetes be cured? How long will I live? These are heart-wrenching questions. If you or a loved one has diabetes, don't lose hope. Today I'll answer the 10 most critical questions about diabetes, from early signs and disease progression to natural ways to control it for a long, healthy life. I hope these insights help you find renewed faith. Diabetes isn't the end, but a reminder to live more balanced and vibrant. Let's begin. Question 1. What are the early signs of diabetes? Many don't realize they have diabetes until a routine checkup or unrelated issue reveals it. Recognizing early signs allows lifestyle adjustments to control blood sugar naturally, often without medication. This video focuses on type 2 diabetes, but I'll cover type 1 in a separate video. If you'd like that, leave a comment below. Type 2 diabetes develops silently, but the body sends warning signals often called the 4 excesses in media: eating a lot, drinking a lot, urinating a lot, and losing weight. Beyond these specific signs include frequent urination, polyuria. You urinate constantly, especially after eating sweets or rice, sometimes 2 to 3 times nightly. High blood sugar forces the kidneys to filter excess sugar, pulling water into urine, causing frequent trips. Constant thirst, polydipsia. Frequent urination dehydrates you, leading to unquenchable thirst. Some drink 4 to 5 liters daily, yet feel dry, especially after sugary foods or fruits, as the body compensates for sugar loss. Rapid hunger, polyphagia. Despite eating, you feel hungry soon after due to insulin resistance or pancreatic issues. Glucose stays in the blood, not reaching cells, leaving them starved and signaling the brain for more food. Unexplained weight loss. Eating more but losing weight occurs because cells can't use glucose, so the body burns fat and muscle for energy, especially in type 1 or advanced type 2 diabetes. Fatigue and lethargy. Cells lack glucose energy, and overworked kidneys from filtering sugar cause exhaustion, leaving you feeling like a car without gas. Other signs: blurred vision, one or both eyes, seeing floaters, peripheral neuropathy, numbness, tingling in hands, feet, dry, itchy skin, or slow-healing wounds, e.g. mosquito bites or scratches, taking months to heal. If you notice these, check your blood sugar immediately at a U.S. clinic or hospital. Question 2. What's unique about the urine of diabetics? Can it reveal the condition? Folklore claims diabetic urine attracts ants due to its sweetness, an observation noted by ancient healers. When blood sugar is high, kidneys filter excess glucose into urine, making it sweet, hence the term diabetes, meaning to pass through. In 1674, English physician Thomas Willis described diabetic urine as sweet like honey. Modern tests replace tasting, but urine characteristics include sweet or fruity odor. Unlike the mild smell of normal urine, diabetic urine may smell slightly sweet or like fermented fruit due to high glucose. In severe cases, it smells like nail polish acetone, indicating ketoacidosis, a dangerous complication. Appearance. Early on, urine is clear and pale due to frequent urination. As diabetes worsens, it may become cloudy from glucose protein leakage or kidney damage with more foam signaling protein loss. If you notice unusual urine odor color or foam, test your blood sugar at a U.S. medical facility to confirm diabetes or kidney issues. Question 3. Can diabetes be fully cured? This haunts anyone diagnosed with diabetes. Modern medicine views type 2 diabetes as a chronic condition with no definitive cure for both type 1 and type 2, whether newly diagnosed or long-standing. The goal is lifelong blood sugar control to prevent complications, not cure. Medications have side effects, and living with diabetes can feel like hell on earth, craving everything, feeling restless and restricted. However, I've helped many patients normalize their HbA1c average blood sugar over 90 days naturally without drugs through balanced diet detox and healthy living. A cure isn't guaranteed as aging reduces pancreatic function requiring precise eating. My view, a balanced diet centered on whole grains, regular detox, and natural living can keep blood sugar safe without medication. You can enjoy whole grains, vegetables, meat, fish, and some fruit without extreme restrictions. Type 2 diabetes often stems from insulin resistance, like a key not fitting a lock. Avoiding refined sugars, sweet fruits, fried foods, and processed carbs gradually realigns this, allowing stable glucose uptake. But if you revert to uncontrolled eating after stabilizing HbA1c, insulin resistance returns faster in diabetics. Control, not cure, depends on diet and lifestyle. Question 4. What foods should diabetics avoid? Diet is critical for diabetes management. As the saying goes, disease enters through the mouth, especially for diabetes. Foods to avoid include sweet fruits, high in fructose. They spike blood sugar, especially when juiced as fiber, which slows sugar absorption is removed. Juicing delivers sugar, rapidly exhausting the liver, which converts fructose to glucose, contributing to fatty liver and inflammation. Refined sugars. Avoid sweets, sugary drinks, e.g., soda, bubble tea. Even healthy bubble tea with full sugar is dangerously sweet. Reduce sugar by 50-70% if indulging and limit intake. Refined carbs and fried foods, instant noodles, fried chicken fries, chips, and donuts are high in refined carbs, salt, and unhealthy fats, spiking blood sugar, harming kidneys, and causing inflammation. Processed foods. Avoid snacks like shrimp chips or fried pastries. Our ancestors ate seasonal unprocessed fruits with fiber, unlike today's overly sweet pesticide-laden varieties. Juicing or over-consuming modern fruits overwhelms the liver and kidneys. Avoiding these foods can reduce diabetes severity significantly. Question 5. Are diabetes medications harmful? Many patients ask if lifelong diabetes drugs are harmful, especially when doctors insist on them. As a pharmacist trained in modern medicine, I understand drugs are vital for blood sugar control to prevent complications like strokes or heart strain. However, long-term use has side effects leading to secondary conditions, e.g., kidney damage, liver stress, heart issues. Starting with one drug, patients may end up on 2, 4, or even 11 medications daily, managing a complex schedule like a high school timetable. This is heartbreaking. My approach isn't to reject Western medicine, but to prioritize natural, control-reserving drugs for emergencies, e.g., pre-surgery, blood sugar stabilization. Common drugs like metformin sulfonylureas or insulin injections stabilize glucose but burden the liver and kidneys, which metabolize and excrete them. Side effects include metformin diarrhea, loss of appetite, sulfonylureas weight gain occasional hypoglycemia, low blood sugar, causing dizziness or collapse. Thiazolidinediones, fluid retention, increased heart failure risk. Combining diabetes drugs with others, e.g., for stomach joints, blood pressure risks, unpredictable interactions, amplifying side effects. A poor diet, e.g., alcohol, smoking late nights, worsens this, leading to fatty liver high triglycerides or kidney failure. I aim to help patients control diabetes, naturally reducing drug dependency using medication as a last resort. Question 6. Can you switch from insulin injections back to oral drugs? Many type 2 diabetics start with oral drugs, but when ineffective, e.g., blood sugar stays at 911 mmol, they switch to insulin injections, replacing pancreatic function. This sparks fear of reaching an end stage. Can you revert to oral drugs or stop insulin? It depends on whether your pancreas still produces endogenous insulin. If insulin resistance is the issue, not pancreatic failure, lifestyle changes can restore sensitivity, allowing a switch back to oral drugs or even no medication. Type 1 diabetics with no insulin production due to autoimmune or pancreatic damage require lifelong injections. For type 2 resistance or eventual pancreatic exhaustion may necessitate insulin. Improving insulin sensitivity through diet and exercise can reduce or eliminate injections, but it requires close collaboration with a doctor or pharmacist. I've seen patients normalize blood sugar naturally, avoiding drugs entirely by adjusting their lifestyle. Question 7. What are the dangerous complications of diabetes? Diabetes is feared for its silent destructive complications, damaging organs and peripheral systems. Cardiovascular issues. High blood sugar causes arterial hardening, narrowing coronary carotid and brain vessels, raising heart attack risk significantly compared to non-diabetics. Blood vessels become brittle like overexposed balloons, prone to bursting under pressure. Kidney failure, a leading cause of chronic kidney disease. High glucose damages kidney microvessels, impairing filtration. Protein leaks into urine, causing foamy, odorous urine. Neuropathy. Excess glucose damages peripheral nerves, especially in extremities, causing numbness, tingling, burning, or stabbing pain in hands, feet. Severe cases lead to foot ulcers or amputations. Eye damage. Glucose accumulates in retinal vessels, causing hemorrhages, swelling or detachment, leading to blurred vision, floaters, flashes, cataracts, or blindness. Infections. High glucose creates an acidic environment, promoting bacterial, fungal, or dental infections. Minor wounds, e.g., mosquito bites, can become large, non-healing ulcers. These complications are severe but preventable with blood sugar control. If you're experiencing these, comment below, and I'll share more videos to guide you with practical steps. Question 8. Why do diabetes, high blood pressure, and high cholesterol often occur together? Known as the metabolic syndrome or triple high sugar blood pressure, lipids. These conditions are linked by shared risk factors: poor lifestyle, refined sugars, sweet fruits, processed carbs, causes inflammation, insulin resistance, high triglycerides, and cholesterol buildup to repair inflamed vessels. Mutual causation. High blood sugar increases blood viscosity, like adding sugar to water, forcing the heart to pump harder, raising blood pressure. Damaged vessels from glucose become rough, trapping cholesterol, narrowing arteries, and further elevating pressure. Inflammation from high sugar stiffens muscles, requiring more blood flow, exacerbating the cycle. This triad creates a vicious cycle, but lifestyle changes can break it. Question 9. Should diabetics avoid all carbohydrates? Many believe cutting all carbs, e.g. rice, controls diabetes, but this is a harmful mistake. The body needs carbs especially for brain function, but not fast-release sugars, e.g. sweets, fruits. Whole grains, brown rice, oats release glucose, slowly preventing spikes and crashes that cause hunger fatigue or brain fog. Avoiding all carbs while eating minimal vegetables, meat, or fruit, and relying on drugs risks memory decline and energy loss. Slow-release carbs like electronic fuel injection deliver steady energy, keeping the body balanced without overloading. Question 10. How long can you live with diabetes? Life expectancy depends on diabetes type control and complications. Type 2 diabetes may reduce lifespan by up to 10 years if poorly managed. Type 1 dependent on insulin from childhood may reduce it by 10-20 years without control. However, statistics vary, some live past 90 with good management. Natural controlled diet, exercise, detox without drugs can normalize lifespan. Don't let diabetes define your years. Let your lifestyle do that. Obsessing over lifespan is less important than daily quality living, joyfully, meaningfully, and loved. A 70-year life full of vitality trumps 90 years bedridden. These 10 questions offer a deeper understanding of diabetes from early signs to long-term management. Living with diabetes isn't easy, but you're not alone. Millions fight it with resilience, knowledge, and optimism. Treat each meal as medicine, each step as therapy, and each moment with nature as healing. Above all, keep a positive spirit. It's the strongest insulin for balance. Thank you for listening to the end.